Welcome to 3 North Pressure Management Acute. This video will orient you with the important information you will need after flap surgery. So let's start off by talking about what a flap surgery is. A flap surgery is a surgical procedure that will help correct deep tissue pressure sore through the manipulation of muscle and tissue over the pressure area. Typically, the cost of a flap surgery is over $100,000. Therefore, it is very important for you to know the care that is needed to increase successful healing of your surgery. Let's talk about the flap surgery process. Before your surgery, you have a wound opening that at times can measure the size of a baseball or as large as a watermelon. These openings can be as deep as to your bone and if not treated can cause severe infection or even death. During your surgery, although your wound opening seems small, the surrounding tissue, especially muscle, must be stretched to close the effective opening. After surgery, you will have a large incision along with a couple of drainage tubes that will help remove blood and fluid from the surgical site. These drainage tubes will be removed once the fluids have stopped draining from the wound. Some factors that can contribute to your flap surgery to fail are drug use, smoking, which constricts the blood flow throughout your body including the wound, not following treatment instructions, muscle spasms, and not eating or drinking enough. You will be working with a dietitian who will go over important information regarding nutrition and wound healing. The next couple of slides will explain what to expect immediately after surgery. After surgery, you will be required to be on strict bed rest in a Clinitron bed or right height like the ones you see on the screen. These beds produce distinct humming noise that may take time to get adjusted to. Your doctors will determine which bed is best for your situation. You will have to remain on your back, which means you cannot turn from side to side. Turning or any kind of unnecessary movement can cause the surgical site to open and further complicate the healing process. This can lead to an extended hospital stay, further surgery, or a prolonged healing process. If there is anything that you would need, do not hesitate to call nursing for assistance. In addition, you will have no bowel program for the first 5 days due to strict turning restriction. Occupational therapy will evaluate you for upper extremity strengthening and provide you with the special equipment to help you reach for items surrounding your bed. Because you have undergone an invasive surgery, both pain and discomfort are expected after the flap surgery. A major priority of the team is to manage your pain. Therefore, you may be frequently asked if you're experiencing pain. It's important for you to report pain as soon as possible so that nurses can identify your early stages of pain. This may help prevent the pain from getting worse. How do we manage your pain? First, we start off by administering pain medication, but there are other forms of pain management which include distraction techniques such as participating in recreation therapy, having internet access, TV, and DVDs. In addition, the use of electrical stimulation can be applied on affected parts that could be causing your pain. We may also consult with a pharmacist or psychologist to help with your pain management. Also, an adduction pillow like the one you see in front of you is placed in between the legs to prevent movement. Remember, we want to minimize movement as much as possible to prevent the surgical site from opening up. Only one sheet will be placed under you to maximize the effectiveness of the specialized bed. Gentle cleaning of your private parts is strongly encouraged. This is very important in maintaining hygiene and preventing infection. And the use of heel protectors are very important to prevent pressure sores by taking off the pressure and minimizing friction that can cause muscle spasms. Lastly, your positioning in bed is very important to the care of the surgical site. Sitting up more than 30 degrees in bed may cause the flap incision to open because the higher the degree, the more pressure is added. Therefore, no sitting up is allowed. Only 1 to 2 small foam wedges and or pillows will be allowed under the head to create no more than a 30-degree angle, just like the example you see in front of you. The Clinitron bed should be adjusted by nursing once every 8 hours to prevent tightness and promote the floating action of the sand in the bed. This is done by gently pulling on the sheet, which causes a rocking-like motion. And the temperature of the bed needs to be between 94 to 98 degrees Fahrenheit. This ensures the therapeutic action of the bed. If you notice an alarming sound or you feel sand in your bed, that may indicate a bed malfunction. Nursing needs to be notified immediately. Next, we will be discussing what to expect on weeks 4 to 5 after flap surgery. Sutures may be removed possibly in week 4 to 5 according to healing. Also, patients can be turned from side to side at this point to allow for bed baths, dressing, and linen changes. In addition, it is very important that the suture line be hydrated with an ointment called Aquaphor. Due to the high temperature of the bed, your skin is prone to dry skin, which can cause your skin to crack open and possible opening of the surgical incision. Aquaphor ointment helps to moisturize along the incision line. On weeks 4 to 5, you will be moved from the Clinitron bed to an air-loss mattress like the ones you see on the screen. In addition, some patients may be allowed to use a prone gurney and be clear for showers with the physician's order. Patients are allowed to attend upper extremity strength training located in the PT gym on the second floor. On week 6, a sitting program is initiated with your physical therapist according to your healing. You start off with half an hour to an hour on the first day. This is increased by half an hour each day until 4 to 6 hours is reached. When these restrictions are not followed, you put yourself at high risk for the surgical incision to open up. Physical therapy will work with you on your transfers until they feel you can do it on your own. Sometimes after surgery, your anatomy may change. Therefore, a physical therapist will do a special test to reevaluate your pressure areas when sitting. Based on the results of this test, a cushion will be selected. And after 4 to 6 hours of sitting, you will be discharged home. A family conference should be scheduled to discuss coordination of your care, a possible home visit, and evaluation of patient family education. In addition, your occupational therapist will check to see if the equipment at home is still suitable or if you may need new equipment to be ordered. Here are some key aspects to prepare for discharge. You will have your first return appointment a month after the day of discharge. However, if you notice any skin problems with the incision or elsewhere, see your doctor immediately. It is essential to check your skin before and after sitting, bathing, and whenever you feel it is necessary. It may take up to 1 to 2 years for your tissue to completely heal and will always be vulnerable to developing a pressure ulcer. That's why pressure releases are essential to maintain the flap post-surgery. It is also very important that you do not overstretch to reach any items, whether in bed or in your wheelchair, as this can cause the surgery line to rip open. Remember to do your 15 seconds of pressure release for every 15 minutes of sitting. Pressure release, pressure release, pressure release. We also want to identify psychosocial aspects to further preventing pressure ulcers. Lifestyle changes greatly impact the prevention of pressure ulcers. These can include compliance with treatment instructions such as dressing changes, pressure releases, sitting program, transfers, moisturizing surgical site, or taking prescribed medications. Avoid drug and alcohol abuse. Being in a state of intoxication can impair your judgment and ability to follow any preventive measures, especially pressure relief. Adequate nutrition intake is important in the healing process. This includes a well-balanced diet with high protein, vitamin D, vitamin C, vitamin E, and a multivitamin. In addition, sufficient fluid intake is important to maintain healthy moisturized skin. Also, caregiver family support is important in motivating you to a healthy lifestyle. Remember, you cannot do this alone. Knowing how to direct your care makes it easier to guide your care from one family member to another. If you suffer from a psychological condition such as depression and do not seek help, it may prevent you from taking care of yourself. This may lead you to developing a pressure ulcer. Here at Rancho, we have psychologists who are available to help treat your depression or any other psychological condition. Lastly, in some cases, you will be discharged with a colostomy bag or the anatomy of your body may be different after surgery with the presence of some scarring and skin discoloration. Some people may have difficulty adjusting to their new body image, and this can place them at high risk for developing a new pressure ulcer. Please talk to your doctor if this is the case. This concludes the orientation of how to care for yourself after flap surgery. For any questions or concerns regarding this information, feel free to speak to anyone in the Pressure Ulcer Acute team. We are here to make your transition a good one.